My name is Christopher Langdon, ENT and head and neck surgeon with a main specialty in rhinology and skull-base surgery. Nasal septum perforation is a destruction of the septum that divides both nostrils. The main causes are postoperatively of septoplasty or rhinoseptoplasty, abuse of toxic substances through the nose, and autoimmune diseases that destruct endonasal tissue. In this center, we are pioneering endonasal reconstruction of nasal perforation. Lately, we developed a new technique to reconstruct total septal perforation using the pericranium, that is the tissue that covers all the skull, and we pass it through the nasal frontal sinus to the nasal cavity and to reconstruct total septal perforation.